I'm Dr. Adriana Potter, the author of Physical Health, and on the Let's Get Physical today, we're gonna go over on a series of balance exercises that every person should be doing it because as we age, we will lose the ability to maintain balance and we don't want to have the risk of falls to increase as we get older. So let's get physical and do some balance exercises. On the first balance exercise, we're going to start with narrow stance and we're going to be moving the head in different directions. The main objective is for you to maintain the balance. Make sure to do these exercises by a countertop in your kitchen or something stable that you can have your hand ready to grab it in case you need it. With the narrow stance, you're going to look up and down for about 10 times. And your feet should be close together. And if you're very wobbly, you want to be doing this by your countertop and your hands is close to grab it. But for now, for demonstration purposes, I will not be doing on the countertop. So that will be 7 and 8, 9, and 10. Second movement will be with the head turning right and left. And this will be good also to keep a good range of motion on your neck. And you should be pain-free motion. And you keep that narrow balance, narrow stance on your feet. 7, 6, oh gosh, it's 9, cannot count, and 10, good. The other one is actually looking up and down, doing big circles, nice and slow. 5 times each way. And 5. And if you're getting dizzy, find a specific focal point across the hall, where you're at, to kind of keep an eye on it. And you have your eyes following the motion so you don't feel dizzy. I actually do feel a little bit because I'm having issues with my inner ear. 4 and 5. Remember, when it comes to balance, there are 3 main systems that help you to maintain balance. You use your visual system to keep some tracking. You have your inner ear that is responsible with the crystals inside and detecting the motion of your head and your body. And we also have some neck receptors. That's why removing the head can disturb your balance sometimes. And we have receptors on your joints, on your ankles, knees, and hips. So you want to be stimulating your eyes, ears, and joints with different surfaces to challenge your balance and maintain a good balance, right? Also, the width of your stance will go from wider to more narrow, which is going to be more difficult, to more like a stagger position of your feet, and eventually to one leg stance. So those are the ways you want to be progressing your balance exercises. Alrighty, so with the narrow stance and head movement, now you can do the stagger. You can do the stagger stance and do the same motion of moving your head. And most people will wobble no matter what. So if you don't want to do the head because that makes you too dizzy, you can kind of just move your arms up and down with a narrow stance. And the weight is even between front and back leg and down. And then you can do the same thing. You can kind of move to the right and left. Now you're doing a little bit of trunk motion, which will disturb a little bit your joints because there is a shift on the center of gravity when you're moving your arms like this. So it will make wobbly. I'm a little wobbly. If you're too wobbly, you don't want to fall. That's the last thing you want it to happen. But that's some of the things you want to be doing it. You maintain your balance. And then you're going to switch to the other foot. So you're going to put the opposite foot in the front of it, and you can do like sweeping right and left, and it kind of helping you to maintain good balance. So I'm challenging myself in here with this and activating those muscles and working. Alrighty, so those are the things you can do it for about 30 seconds. There's no right or wrong. If you're wobbly, you're practicing. There's no point of practicing something is easy, so it has to be a little challenging, okay? So another one you can do, you can kind of just on a narrow stance, you can close your eyes and just take the vision away. As you can see, I wobble a little bit, but I maintain the balance. If this is too challenging for you, you can stagger your feet a little bit offset in here. And you may find like, oh yeah, that's much easier, but I still wobble a little bit. Alrighty, so every time you close your eyes, you take the vision out of count, and you have to rely more on what your joints is feeling and your center of gravity, how you're feeling for that, okay? So you can do everything with a narrow stance with the eyes closed, and you kind of work with that. And you can, again, you can be just the feet too close together, eyes closed, and you're doing like a tree dance, and that might be as far as it go. So a minute or two that you do every day, it will help you to improve your balance. Keep your eyes closed and shift your weight right and left, and kind of helping with maintaining the good control. Okay, so those are the things you do when both feet close together. And if like you saw, some of these exercises for me, they were a little bit challenging, but I was able to maintain a good balance. So you want to make sure that it is very safe to do it. If you have a loved one that is a little bit elderly, but you're caring for them, you make sure to do with them so they're always safe. Safety is the number one thing. You don't want to be doing this and having a fall and end up hurting it. And this is just helping you to maintain a good balance. So this is ideal for people that doesn't have a lot of balance issues, but they want to improve a little bit so it doesn't get worse. If you're having a lot of balance issues, they should be doing physical therapy, okay, with the physical therapist, which is the safest environment because they will know exactly which level it should be done for those people that have very, very bad balance, okay? The next balance we're going to do is actually doing an easy one. Everybody can do this. It's single leg balance, right? And it can be very, very wobbly. I tell my patients all the time, you have to brush your teeth twice a day. It's about 2 minutes. So go ahead and doing this motion and single leg balance by your countertop in the bathroom, and you brush your teeth and you hold it there for 30 seconds or so. And if you have those electric toothbrushes, it will change it, tell the time when it's time for you to change to a different leg. And so the longer you do, the better it is. And then you switch to the other leg and make sure the hips are level. We don't want the hips to be dropping like this. You can see how this is a bed, you're not using your muscles as much, and it makes you off balance. If you keep hip elevated and level, this is ideal. Then you're working a lot of strength in this hip and maintaining good balance and engaging your muscles the right way. So 30 seconds in each leg, swapping right and left. It will help you to improve your balance. And if this is not very challenging, remember what I mentioned to you, moving your arms, moving your head, and kind of disturbing a little bit of your balance. If you wobble, it's challenging. Anytime you need it, put that foot down, alrighty? So I'm gonna switch to the other side. So another one that is a little bit more dynamic exercise that you will be able to do too, that is kind of a little bit more engaging, is kind of up and down. So moving, doing a little bit of that leg drive versus the head movement drive or the arm movement drive. So you can just do a little bit of the open chain, leg abduction, which is the side kicks in here, and you touch your foot every time, or you keep the foot in the air the whole time with those 10 repetitions. And you don't have to have resistance for this exercise. You can just do this. It's a good strengthening for the hip. So there's a little bit of the shifting in here. You can see me leaning slightly to the side, and then we'll kind of help you to do it. And then you go ahead and switch to the other side and do the hip abduction. Whether you put your foot with the toe touch down or keep the leg in the air the whole time and you never touch that foot down for your single leg balance with the drive of the leg. So that's the one plane motion. So we're gonna move the direction of our plane of motion because we just did the sagittal. Now we're gonna do the frontal plane, right? And we're actually gonna be doing a little bit of leg swings back and forth. And the standing leg, watch for that knee. You should be unlocked. You should be able to do a little bit of that bending the whole time. Your knee should not be locked when you're standing in any time. Your knee should be always having that little bit micro bending in there. So 9 and 10 and the other side. So if you're locking in the knee, you're having too much contact surface on your joints and you're gonna hurt later on that standing knee. And so you wanna be doing that little bit of micro bending so your muscles can make small adjustments for your balance exercise. Alrighty, so the last one we're gonna be doing for this exercise is a little bit of that rotation on the transverse plane, right? And that would be the most challenging one. So there's different ways you can do. So think about it. You're shifting your way to the standing leg and you touch and you touch. So you're pivoting over the standing leg, again with a micro bend, or you can keep the leg in the air and you are pivoting your hip in that rotation over there. So that's one way, doing that motion. 8, 9, and 10, and the other side, same thing, keep the leg in the air, all toe touch, you rotate to either 2 o'clock or 11 o'clock, 12 o'clock being the forward in front of you, and no joint pain with these motions. If you're having any issues and creating pain, please do not do that. And you should address that with a physical therapist to help you guide you what's the right way. Alrighty, so that was STEM. So those are the most common exercises that you will be given to do as a home exercise for balance, whether you're moving your head, moving your arms, closing your eyes, and you're not dealing with any soft surface. You are doing this on a hard surface, preferably with good shoes. When you're doing bare feet is different. So there's another way to modify how you're doing your balance exercises. 5 to 10 minutes every day. It will help you with strengthening your legs and improving your balance. So the next step of the balance exercises you should be doing on different surfaces, which is another story, another video that we're going to do in the future. But those are the basics that it will help you to improve. So pick the one you like the most and do it often. So that way you know exactly what your muscles are doing it and challenging. If it's too easy, there's no point in doing it. You always want to challenge your body to do a little bit more difficult exercises, because if you're struggling, there's room for improvement. So you want to be doing that. I'm Dr. Adriana Potter, the author of Physical Health and Let's Get Physical and Benefit Yourself series. I hope you enjoy our video, and don't forget to subscribe and press the button for future videos. Take care.